with that, Mr. President, the plan to repeal the Affordable Care Act with no replacement kind of reminds me of a car that I used to have. It was an okay car. I bought it in, I remember, I bought it in '06, but it was an '05, but it was new. It was one of those at the sort of the back of the lot, and basically I got it for $2,500 less than MSRP. It was a station wagon. It was ugly. It was purple. And I just sort of rode it into the ground. I kept driving it. I didn't take great care of it. I've gotten better about taking care of my cars. But at the time, you know, I just rode it and rode it and rode it. And, you know, the AC busted. I didn't fix it. There was a fender bender. I didn't fix that. The car was okay, but it needed some TLC. But it got me around. And what if I had taken this car to Jiffy Lube in Honolulu just to get a little tune-up and left it, and then I came back an hour later and it had been dismantled? That's what the Republicans are doing with the Affordable Care Act. Instead of fixing what's wrong and keeping what's working, they're going to destroy the American healthcare system. And I try very hard not to be too apocryphal with my language. I try very hard not to be too nasty and too partisan on this floor, but this is factual. They are going to destroy the American healthcare system. That's what repeal and replace is all about. They're going to remove a law from the books and come up with something terrific in a few months or a few years. But they're also going to keep the stuff you like. So here's the first thing that everybody across the country needs to know about this process. It's not on the level. There's no way around it. This is just not on the level. People know, anybody who's spent any time thinking about healthcare policy knows that covering people with pre-existing conditions like cancer, mental illness, diabetes, it's a popular thing to do. It's the right thing to do. People also know that the only way to do that is to create a risk pool that includes healthy people. If you're going to insure folks, you can't just be paying out for the expensive cases. You also have to be bringing in revenue and not paying out. So you need young people in the risk pool, you need professionals in the risk pool, you need non-sick people in the risk pool. And that's how this all works. Everybody understands that. Everybody who's working on this in good faith understands that you need to create a risk pool in order to cover more people. So they know that if they eliminate the individual mandate, they eliminate the benefit. But they're stuck with a promise that they've made to repeal this law, and totally, root and branch, not to improve upon the law. And just remember that it was an article of faith that we couldn't make even the most modest improvements to this law at any point in the last 6 or 7 years. That if you did so, that you ran afoul of Republican orthodoxy. So it's not that they wanted to fix the law, it's that they had told everybody that it was so bad, partly because it was Obamacare, that there was nothing good in it, that there was nothing worth preserving about the Affordable Care Act. And so now they're into repeal and replace. They are stuck with the promise that they made to repeal this law totally, and they know people are about to be very, very angry because President Obama is only the president for another 10 days. And people are not going to accept the premise that we're going to rip health care out from you, but don't you hate health care because it's called Obamacare? That's an argument that may have worked 3 or 4 or 5 years ago, but with a new president-elect and a new Congress, we have an obligation to have a better strategy than that. Republicans do not have a replacement plan. If they had one, they'd be adopting it shortly. It's been 7 years. It has been 7 years. And we haven't seen any legislative language. None. They have no plan at all for American health care other than to cause immediate harm and to try to blame it on the law that they are repealing. There are only a few ways that this could end up. I'll give you a couple of them. First, there could be the equivalent of a healthcare cliff, which is similar to what we've done with our fiscal situation, where they have to periodically shovel money at the problem and bail out the insurance companies. So what's going to happen is they're basically eviscerating the revenue that provides the subsidies for individuals, but then they're going to realize, hey, you know what, these subsidies are quite popular, but we just eliminated the revenue. We don't want to increase taxes, so let's borrow money and keep shoveling money at the insurance companies. Or they may make minor reforms in the AC and call it a replacement. That would be great. I do not see that we are on this path right now. Or they're really going to repeal the law and take health care coverage away from millions of Americans. This is completely irresponsible. So what happens when they repeal ACA? 22 million people will have their health care coverage ripped away from them. More than 22 million men, women, and children. For those of you who still have coverage, I want you to know that this impacts you too. If you have a pre-existing condition as common as diabetes or high blood pressure or mental health issues or cancer or Crohn's disease or lupus, or in a lot of instances, pregnancy is a pre-existing condition, you are not going to be able to keep your coverage. If you're a woman, you're likely going to lose access to preventative health care services like birth control. And if you live in a rural area, everybody in rural America should understand this. And you know, there's this thought that there are rural states and non-rural states. Every state is both a rural state and a non-rural state. I know the presiding officer has an urban area and plenty of rural areas. I have one of the densest cities in the United States, and then I have far-flung, very small towns that are old plantation towns. So everybody in the United States Senate represents rural America in some form or fashion. If you live in a rural area, chances are that your local hospital will lose millions of dollars in funding, which will force many rural hospitals to turn away patients and close their doors. This is not an exaggeration, and I encourage every Republican member of the Senate, member of the House, citizen out there to ask their healthcare leaders in rural hospitals what is about to happen. They are in a panic. Let's be totally clear about what this means. You lose rural hospital money, and you lose rural hospitals. And for a lot of small towns, from Hawaii to the Dakotas to the Carolinas and everywhere in between, the rural hospital is the economic center of the community. It's often by far the largest employer. And so I want you to understand, if a rural community loses its rural hospital, a lot of the working age folks leave. They move to a more urban area. And what happens is the elderly citizens also have to leave, because if you need access to emergency services, but you are nowhere near any of that care, you're going to have to go too. And so there is not a single thing that we could do in the Congress that would harm rural communities quicker than what is being done this week by the Republicans. I want to be really clear about how much harm is about to be done to rural communities. Not just rural healthcare providers, not just nurses and doctors and technicians and admins and janitors and everybody who works at those rural hospitals. That's important, because in a lot of instances, that's the economic driver of a small town. But it's also about people start to make choices with their own life and with their own planning, especially as they get older, and they think to themselves, how do I stay close to health care? And if that rural hospital goes away, that rural town goes away. And we've seen it in Hawaii, and that's why we fight for Molokai Community Hospital. That's why we fight for Lanai Community Hospital. That's why we fight for Waianae Comprehensive Coast Treatment Center. That's why everybody fights so hard for their community rural hospitals, because it's the center of a community, not just economically, but without it, you basically have no community. All of this will cause the entire insurance market to unravel, raising costs for everyone. This means families are going to pay more for prescription drugs, paying more on their premiums, and paying more for out-of-pocket costs. And so if the Republicans are still unfazed by the health impacts of the repeal that I just outlined and have been outlined for the last 4 or 5 hours over the last 3 or 4 days, there's another reason to be extremely cautious about what's about to happen. As we know, the vehicle for this is a budget resolution, right? And they're trying to characterize this as though it's not a budget resolution, but the only reason they're doing it as a budget vehicle is so they can do reconciliation. What does that mean? That means they only need 51 votes where otherwise they would need 60 votes. But this is a budget. If it were not a budget, they wouldn't be subject to the 51-vote threshold. This is the federal budget. And this federal budget increases the deficit by trillions of dollars. This federal budget increases the deficit by trillions of dollars. Not trillions of dollars at a flat line with a previous federal budget. This is trillions of dollars more than last year's federal budget. And so if you are a fiscal hawk, gosh, you must be swallowing hard over the next couple of days. This must be a bitter pill to swallow, because on the one hand, boy, do you hate Obamacare. On the other hand, boy, do you hate running up the national deficit, not the debt, deficit by trillions of dollars. This is insane. This deficit, what we are doing to the debt and deficit in the next 2 or 3 days makes everything that we've done in the last 3 or 4 years pale in comparison. If you are a fiscal hawk, I cannot see how you get to yes on this. You cannot vote to increase the national debt by trillions of dollars and then still call yourself a fiscal hawk. And so we have a choice in front of us. Do we build on the progress of the Affordable Care Act, or do we strip millions of Americans of their health care coverage, leave those with pre-existing conditions out in the cold, and raise the national debt? We know ACA has its flaws. No one ever said it was perfect, and let's be clear, every major piece of legislation, every signature piece of legislation that this body has ever passed has been flawed in some way. And what do we do when we're a functioning world's greatest deliberative body? We iterate it. We work on a bipartisan basis to fix it. And that's what we should do. The benefits of ACA are undeniable. And that's what we should be debating, improvements to the ACA, not an implosion. And so let's keep our eye on the ball and remember what our common goal is: giving every American the opportunity to get quality, affordable health care that they deserve. I yield the floor.